Hello, Dr. Kathy Miller here at Doctors Hearing Care in New Albany, Indiana. Have you ever walked out of a hearing test and been told a number, like you have 20% hearing loss, and thought, okay, but what does that actually mean for me? If that's you, you're not alone. And honestly, you're asking exactly the right question. Here's the truth. Hearing loss really isn't something we can accurately describe as a percentage. It's actually measured in decibels, and that is then translated into a degree: normal, mild, moderate, severe, or profound. And it's not always the same across the board. You might have mild hearing loss in the low frequencies, but moderate or even severe hearing loss in the high pitches. A single percent score just doesn't capture that. So where does that percentage number come from? This is where the confusion happens. That number is usually a measure of your percent of word understanding. You're given words at a comfortable volume and you're scored on how many you get right. That's a part of your audiological evaluation, but it's not your amount of hearing loss. In fact, someone with pretty significant hearing loss could still score above 80% on that test once the words are loud enough. So if you've been told the percent of hearing loss, I would just wonder, were you given the full picture or was it maybe misunderstood along the way? Either way, it's a really common mix-up. If you've got questions about your hearing or about your hearing test, the next step is a full evaluation with a qualified doctor of audiology. That's what we do at Doctors Hearing Care in New Albany, Indiana. Give us a call at 812-949-3272. Let's get you some clear and accurate answers.